Peripheral neuropathy is a disease that affects 25 to 40 million Americans. It's a disease of the peripheral nerves, which are in your hands or your feet. The little capillaries that wrap around those nerve endings begin to die, begin to disintegrate. So then the nerve dies. Without blood flow, it's going to die. It's epidemic in our society and it's very painful. So patients most of the time don't sleep very well at night. They can describe it as pain, numbness, tingling, ants crawling up their feet. And a lot of times they lose their balance. Some were in wheelchairs, some had walkers, and some had canes. And people don't know what to do because the medical profession doesn't use this, they use drugs. And they cover up the symptoms instead of treating the cause. So when I first got into this, I said, how do I increase blood flow? So those nerves, when they begin to die, what I do with the modalities of nutrition is I push those things into the capillaries and they begin to grow. So we actually create more capillaries. So our program is designed to increase capillaries and increase blood flow. And so what happens over that 90 days is we're just increasing capillaries and the patients get better. So the first thing we do when a patient comes, we obviously do the exam and come up with a sensory loss that they have. First treatment they do is something called the rebuilder. They do it at home, and then they use what's called the anodyne low-level laser. Usually it's an hour and a half of both of those treatments in the morning and an hour and a half at night. Then we give them a big box of nutrition that lasts them 90 days. A big box, 3 of them are things they digest, they mix them up, they drink them down, and the other thing is it's a cream that I developed that we rub on their feet. When they come to the clinic, it all depends on how severe they are. So if they come to the clinic, there's usually 2 standard things I do. It's called the NeuroMed, or it's called the Class 4 cutting edge laser. The other thing that I may add is soft wave therapy or tissue regenerative therapy. Those are the main components. And then when they get through the program, then we start working on their balance. We have a machine called Pro Balance, and we put them on a little computer and they get 10 to 12 visits on that, and we help with their balance. My neuropathy patients, I don't think I've ever had one of them miss. They keep to their appointments. Usually we do about 24 treatments here at the clinic during that 90 days, but they never miss. They are just black belted because we're giving them their life back and they can see the results. So honestly, my neuropathy has been the best thing I ever did.